Okay, let's go over week 5 meds first. So this week you can see I kind of separated it out into the different, there's a little bit probably more info on here, but it's separated so that you can see what is what a little bit better, I think. So let's look at these. Lipitor, when you first look at that word, what do you notice in that? Lipid, right? Sounds like lipid. So think that. So it's a cholesterol medicine. That's totally spelled wrong. It should be a atorvastatin, I believe. I'll look it up. Let me fix that. Okay. And it's a statin. So we know, what is one thing that we know about statin as far as pregnancy goes? Don't look.
It's not good.
Category X. Okay. And we know that statins are for what indication?
Hypertension. Hypermyalgia. Hyper something.
All statins, their indication is for high cholesterol, hyperlipidemia or hypercholesteremia. We had some statins last week. Kind of. Okay, and then cardiovascular disease prevention, that is really just a matter of how it gets rid of cholesterol, so it keeps it from getting kind of on the inside of your blood vessels. So side effects may cause myopathy, and I think that goes for most statins too. So muscle disease or rhabdomyolysis, which is like a breakdown of your muscles. I think that is what they determined that Miss Colvin had. I remember, Miss Colvin, she used to work in the elementary. And then she got really sick last year, remember? And she was in the hospital for a long time.
Was she really?
Anyway, avoid grapefruit juice. Okay, so that one.
What about just grapefruit?
Something specific. Probably grapefruit too, yeah. I think. So it has something to do with how it absorbs the medicine, or how it makes you absorb the medicine or not absorb. So risk of myopathy when given with these other medicines. Monitor when given with digoxin. That is that heart medicine that we've talked about before, digitalis, digoxin. And it's contraindicated with liver disease, which most of the statins are. So, okay, the next one, Prilosec or omeprazole is a proton pump inhibitor. Do what?
I call it Prilosec, but yeah. Isn't that the heartburn stuff?
Mm-hmm.
Yep.
Yeah. Duodenal or gastric ulcer. Your duodenum or duodenum, I've heard it pronounced both ways. It's actually like the first part of your small intestine, and so whenever you see that, it's like the first section. See how it's got? You can't really see the middle one, but duodenum, jejunum, and ileum. You got 3 sections of your small intestine.
I've heard if you punch somebody in the jejunum, they can actually pee themselves. Is that true?
What?
I'm sorry.
I don't know what you're talking about right now. It's jejunum, and that's your intestine, so I don't know why that would make. I don't know. Okay, let's just keep going. Erosive esophagitis, which obviously that's in the esophagus. Erosive means that they're like probably ulcerated or has an erosion. And then GERD, which is what? We've had that one a lot. Gastroesophageal reflux disease. Okay, you need to know that one because that's on a lot of these. So basically, GERD causes chronic heartburn. Sometimes people have to have surgery to have it fixed too. So side effects: headache, nausea, vomiting, diarrhea, which is pretty much every medicine causes nausea, vomiting, or diarrhea. Not everyone, but a lot. And then flatulence. Everybody know what that is? Gas.
Yeah, I was going to say that, but.
Gas. Makes antiretrovirals less effective. Okay, those are like your HIV medicines or your retrovirals, antiretrovirals. Increased bleeding time with warfarin. Okay, warfarin and Coumadin are the same medicine. That's that. We've talked about it a little bit before because it's a really strong anticoagulant. It makes, bleeding is an issue with it, and so they increase bleeding time so it can make it work, more than it normally would. And then comes in delayed release capsule so that it can be given over a long period of time. Augmentin is a combo antibiotic, so it's got amoxicillin and clavulanate. It's a penicillin antibiotic, like I said, combination. So it's for bacterial infections. Antibiotics are always going to be for bacterial infections, not for viral infections. Okay, lower respiratory infections, skin infections, sinus infections, otitis media, which is what? Middle ear infection. Remember that from the other day? And then a UTI, urinary tract infection. So this is used for all those. Nausea, vomiting, diarrhea, or rash can be a side effect. Risk for superinfections. A superinfection is like candidiasis, like a yeast infection, or thrush in the mouth, where you have like an over buildup of your normal bacteria. Okay. Or superinfection could also be even something. There are worse ones, like I think C. diff is considered a superinfection. So it's just where you have other bacteria that kind of takes over because this antibiotic has gotten rid of. It's like you have this imbalance kind of. Prolonged blood concentration, if you take it with probenecid. Risk of increased bleeding with anticoagulants. Decreased effectiveness of birth control. That's pretty standard for most antibiotics. They decrease the effectiveness of birth control. Contraindicated with liver dysfunction. Lots of them are with that. Refrigerate after you reconstitute it. Remember, reconstitution is just the act of mixing it with whatever solution you're mixing it with, water or whatever. So it needs to be refrigerated. Okay. Now, amoxicillin, you know how the pink bubblegum stuff like we talked about last week, it doesn't actually have to be refrigerated. It's just usually easier for people to take when it's refrigerated. It tastes a little bit better, yeah. This has to be refrigerated. It's usually white. So, Tenormin, or at least it used to be, unless they made something. Tenormin or atenolol, okay, see that O-L-O-L at the end of that, atenolol? That tells you that it's a what? Beta blocker. Did y'all take your quiz yesterday?
We took it Friday.
Yeah, because we thought we had it and then the filter got canceled.
Okay, good. Beta blocker, hypertension for hypertension or an acute myocardial infarction, or angina, which is chest pain. Okay, that's related to CAD. What's CAD? Coronary artery disease.
Yep.
So that's just disease, plaque buildup in the arteries that surround the heart itself. Okay, coronary artery disease. That's what causes coronary artery disease can cause heart attacks. So that's what it's for. It can cause bradycardia, which is
slow heart
rate. Okay, and that's because that's part of its purpose is to kind of slow the contractility of the heart. Postural hypotension, which is what?
Dizziness when you sit up?
Yes. So your blood pressure drops a little whenever you stand up. Good. And then arrhythmias, which is just an abnormal rhythm. Okay, or you don't have a rhythm, like a heart doesn't have a normal rhythm. Monitor for added effects with amiodarone. So if they take it with, amiodarone is another cardiac drug. So if they take it with that, okay, then they have added effects. Pregnancy category D. Okay, renal impairment can be an adverse effect. Bradycardia, again, heart failure. I mean, that's what it's for, kind of. Don't stop it abruptly. It's something that you'd want to wean somebody off of. Most medicines, you wouldn't want to stop abruptly. Okay, and that'll be a question you'll get. And typically, if that's a question that they ask you on here, like on the online program, then usually the answer is you don't want them to stop taking it abruptly. Unless it's something that's like, if it's like knocked him out or something, obviously. But normally that's the case. You don't want to stop most medications abruptly. You want to wean yourself off of them, especially antidepressants or any kind of psychotropic medicine. Lasix is a brand name for furosemide. This is another very commonly prescribed medication. It's a diuretic. Okay, so the purpose that people take it is hypertension, or they might take it for edema. Okay, everybody remember what edema is? That's something we've talked about before, but not this year. Edema is like swelling. Remember I showed y'all pictures before that like handprint will be in their leg? You know what I'm talking about? Like you can put fingerprints in their legs and stuff. So, anyways, you know what I'm talking about? We looked at pictures. It's like like around their feet and legs. You can actually put like an imprint in their leg.
Sure.
because there's so much fluid on there. Okay.
Yes, we talked about it. Last
We
year.
have.
I don't remember it, but okay.
I'll look up a picture.
What did you do?
I shut up here.
That's called blanching, what you're doing right there.
Oh, okay.
No, it's like where you like touch it and then stir it like
Hole.
a. It looks like a.
Okay, here.
That's just where you
This
like.
one's got cellulitis too, so
It's like those
That's a good picture.
the mattresses or whatever.
A memory foam mattresses.
Huh?
And Chevy Beat.
Yes, that's what I'm talking about. Where you like do that and it like leaves a handprint.
okay, this is edema.
Whoop.
Okay, so you can tell their leg is really now all this red and scaliness, that's called cellulitis. And a lot of times people get cellulitis when they have really bad edema. Because the fluid, it's like lymphatic fluid that basically can't get reabsorbed. It has to do if you eat a lot of sodium, like a lot of salt, it'll make you hold water, remember, because water follows salt. Remember we learned about that when we talked about tonicity and all that.
Do they get like holes in their feet?
Makes you hold water, hold fluid, and because of a lack of circulation, then it also it tends to pool, especially at the legs. Sometimes people get edema in their belly too. This is an area where what can happen is some of that fluid actually will like seep out of their legs, and so that can cause really bad inflammation of the skin. But edema is just a swelling part, and it usually indents. Like you can leave an indentation in.
Will it go away?
Yeah, once they take some diuretics, that fluid will go away. But this is one of the reasons people get prescribed diuretics, okay, especially furosemide or Lasix, is for swelling, okay, and it also has to do with the heart rate because they usually have increased high blood pressure with that, and so getting rid of extra fluid will decrease blood pressure. It's just like there's so many different ways. Think about water flowing through a pipe, okay? There's a lot of different ways to decrease the pressure that's water's flowing through something. So one way is to get rid of some of the water, right? Think about like a water hose, okay? So you decrease pressure by lowering the amount of water that's in there, right? That's one way. If you widened, if you got a bigger hose, okay, that's going to be another way to lower pressure, right? That would be like vasodilation. Like dilating a blood vessel would lower blood pressure. Okay, slowing down the rate at which water comes out, wouldn't that also slow down the pressure? Okay, that's the same idea. So those are all ways that blood pressure can be fixed, if you will. Okay, so this diuretic is just getting rid of some of the fluid. Okay, so that's one thing. It says side effects are excessive urine production, obviously, because that fluid has to go somewhere. Okay, that's how you get rid of it. Dehydration, obviously, because you're getting rid of lots of fluid. And then another one, look, is hypokalemia. What is that?
Low potassium.
Low potassium. Remember K, kalemia, K for potassium, like on your periodic table. Hyponatremia would be what?
Low nitrogen.
Natrium is sodium.
I mean,
Like Na on the periodic table, okay? So hypokalemia. The reason this does this, okay, is because when this medicine makes you get rid of fluid, then it also makes you it also flushes the potassium out of your kidneys. Like your kidneys are flushing out tons and tons of water, okay? Well, it's also, potassium is going to follow along in there too. So that can make your potassium get really low. So for that reason, you normally will see Lasix also given with potassium. So like if you're working in the pharmacy, that's one thing you might take note of. If they only pick up Lasix or furosemide, okay, make sure that they've got potassium too, or at least that it's been addressed. Maybe they don't need it because their potassium level's high, but at least it needs to be questioned if it's not prescribed with potassium. Because they're usually given together. Not always. The doctor may have a reason not to do that, but normally it is, because otherwise if your potassium gets off, you have major cardiovascular effects, because, like we talked about remember we talked about action potentials and anatomy, and that's potassium and sodium are required for that depolarization to occur. Remember that? Jacob, you good? Follow
Yes.
along? Take early in the day to avoid bathroom trips at night. Okay, if they take this medicine at 9 o'clock at night, they're going to be up every hour to go pee. Okay, so they want to take their medicine in the morning usually, and then usually if they take 2 doses, they might take like a morning dose and an afternoon dose, okay, instead of like morning and night, because otherwise they're going to be up all night. Contraindicated with anuria, which would be what? And means what? Without. Urea.
Urine.
Yes. So if their kidneys are not functioning enough for them to go to the bathroom, they don't need to take this because they're going to have major issues. Okay, monitor kidney function labs. That's always something that you want to monitor because this is going to overwork their kidneys a little bit. Not in a bad way, but it's going to make them work pretty hard. So if their kidneys aren't functioning, this is not a good medicine for them. Usually, like I said, administered with potassium. Low pressure, metoprolol. So again, the OLOL tells you it's a beta blocker. So it works on high blood pressure. So hypertension, myocardial infarction, or angina, the chest pain again. Again, side effect, bradycardia, hypotension, arrhythmia. See, a lot of these are the same as that tenormin. Those are the same classification. Don't stop abruptly. Again, same as before. Don't stop abruptly because of the risk of myocardial infarction. Bradycardia, specifically when taken with digitalis, because that also causes bradycardia. Okay, they're going to have some added effects. Take precautions with clonidine, which is, wasn't that on our med list last week? Clonidine. Okay, well, it will be soon if it's not, if we haven't had it yet. I can't remember right now. Clonidine is it's for hypertension, but it works really fast and it's really potent. Contraindicated with bronchospastic disease, bradycardia, and that's typical beta blocker. Okay, monitor with cardiac failure. You don't want to be careful with that because it can make it worse. And just like we talked about with the atenolol, cardiac heart failure is a possibility. Zoloft or sertraline. This is an SSRI, so it's an antidepressant. Okay, I'm on the back of this, right? You've probably heard of Zoloft before. That's a pretty commonly prescribed drug too. SSRI, selective serotonin reuptake inhibitor. So it works on the neurotransmitters that go there. Okay, MDD is major depressive disorder. Y'all know what OCD is, right? Obsessive compulsive disorder. Panic disorder, PTSD. PMDD is premenstrual dysphoric disorder, which is like extreme PMS, like major depression and all the stuff that goes on with that.
Well, that's a bad deal.
Social anxiety disorder is another one. So typically side effects, decreased sex drive, ejaculation failure, headache, dizziness, dry mouth, insomnia, nausea, vomiting, whole mess of. And you'll see there's a lot of sexually related side effects with antidepressants, and you'll see that on a lot of these. Increased risk for worsening depression or suicide. Most antidepressants also have a risk of worsening the depression or, causing not causing the suicide, but yeah. So that's always something that has to be, especially after they're first given, that really monitored because they may need a different type of antidepressant.
So
I know it doesn't make any sense. I don't understand that, but contraindicated with MAOIs, which is another type of antidepressant. And remember, we talked about MAOIs before. They have lots of interactions with other medicines. Bactroban, this is basically kind of like Neosporin. Okay, it's an ointment. It's an antibiotic ointment. Side effect, burning, itching, rash. Sometimes people are allergic to it. Pretty much that. Rheumotrex, okay. Methotrexate is another one. This is frequently prescribed. You'll hear this a lot. It's an antimetabolite. It's a lot of time used for, you'll see it a lot for rheumatoid arthritis, hence the Rheumotrex. Neoplastic disease, RA, that's rheumatoid arthritis, severe psoriasis. You know what psoriasis is? You see it on TV sometimes. It's a skin disorder.
Those rashes.
Yes, but it's like a silvery, scaly skin disease. Really, really dry skin. Side effects, nausea, vomiting, stomatitis, leukopenia, which is like a decreased amount of white blood cells, immunosuppression. So yeah, this is going to And this has some pretty severe side effects. And you'll probably see this drug on here some too. Monitor while taking NSAIDs, Tylenol, or antibiotics. Pregnancy category X for male and females. Certain
That means like you can't produce.
Oh, okay.
pregnancy category X. That means it would be detrimental if the male or the female were taking it and pregnancy occurred.
Okay.
Certain blood disorders, renal impairment, liver disease, monitor renal and liver labs, and CBC. Lots of lab work. Okay, because this is pretty potent medication. Nexium, purple pill. Y'all seen commercial for the purple pill? It's a proton pump inhibitor. Notice the Prozol. Okay, that tells you it's a proton pump inhibitor, the ending there. For GERD, again, healing of erosive esophagitis. I will never forget what Nexium is for, because when I was, I told you this story before, but when I was in Africa, I don't remember which time. I guess it was my last time. Or when I went to Ethiopia, not the very last time. But I was taking doxycycline for, like, to prevent, it prevents, like, traveler's diarrhea. It's supposed to prevent malaria, or at least some types of malaria. So I was taking that, and one night I could not get to the kitchen, and I knew I'd been bitten by mosquitoes. So I was like, I've got to take my medicine. And I couldn't get to the kitchen to get water, and so I just took it without drinking anything. I thought, I'll be fine. Well, no, it got stuck somewhere along my esophagus and like eroded it. I mean, I had like an ulcer in my esophagus. It was the worst pain ever. Well, almost ever. And it just felt like I was swallowing a knife that was like turned this direction is what it felt like. It was like every time I swallowed. Even just swallowing like saliva, I couldn't do anything. So the whole flight home, this was the day before I was leaving. I didn't eat anything like the whole way home. It was a miserable couple of days of traveling, but I won't. So, and I took Nexium. I took like 10 days of Nexium, and it completely healed it. It was all better. So, anyway. Reduce the risk of an NSAID ulcer. So an ulcer that can be caused by, taking Motrin or Tramadol or something like that. Side effects: headache, nausea, diarrhea, change in taste. That occurs sometimes. There's some medicines that cause that. Makes antiretrovirals less effective. So again, that's like the HIV meds. And then comes in delayed release capsules, so it can be over a long period of time. Okay, so that's your meds. Let's look at